Before I hand it, oh, their recording has started. Before I hand it over to Dr. Sparrow, I just wanted to introduce her a little bit. She's new to me as well, but I've heard very good things from colleagues, and Alexa knows her fairly well. So Dr. Caitlin Sparrow grew up in Kamloops, so she's a local girl, which we love. She is a certified respirologist by the Royal College, and she completed her Bachelor of Science at the Thompson Rivers University, where I am at. Um, a Bachelor of Science in Chemistry with honors. Oh, chemistry biology with honors. Wow. Okay, she's even bigger than me. While she was playing soccer for our Wolfpack team, she completed her medical degree at the University of Calgary and did her subspecialty training in internal medicine and respirology at the University of Alberta. Her interest outside of all of the schooling she takes is airway disease and preventative care, so I think she fits in lovely with us. And outside of her practice, she enjoys soccer, traveling, and spending time with her dog, Rosalind. And I just have to ask, what type of dog is she, Caitlin?
Oh, so she's a rescue. So she's half, I think, pit bull and black lab. So she's kind of
A big,
little,
beautiful girl.
yeah, she's chunky. Yes.
Wonderful. So without further ado, I'm going to hand it over to Caitlin and let her share her screen. Please make sure that you are muted if you are not already. Thanks, everybody.
All right. Can you see that okay?
Yes.
All right. So thank you for the wonderful introduction. I'm really happy to be here. So again, my name is Dr. Sparrow or Katie. And today I'll be talking about a very important topic, and hopefully you can take away or learn a few things for the next 30 minutes. So we'll be talking about vaccines for the COPD patient. So today's agenda, this is what we'll be discussing over the next 30 minutes. So we'll talk about the importance of vaccination for people with COPD and why it's important. And then we'll dive deep into 5 specific vaccinations. So we'll talk about the flu, pneumococcal, COVID, pertussis, and RSV. We'll cover everything from how the viruses and bacteria are transmitted, what's available in terms of vaccinations, potential side effects, and what the cost is here in Canada. And I'll try to focus on BC as well. Then we'll tie it all together with a practical guide on a vaccine schedule and other preventative measures you can take to protect your own health as well as others. And then at the end, we'll quickly review what we chatted about, and we'll have time for questions as well. So this figure is from the Government of BC website on the non-pharmacological management of COPD. There's various other guidelines that have similar structure. There's various aspects such as self-management, smoking, exercise, pulmonary rehab that all contribute to doing better and living better with COPD. And one of the main focuses is vaccinations, which is included in all of the guidelines and which we're covering on today. So it's just a small piece of the pie, but it's very important. So many of you know COPD is a chronic and progressive condition. In this condition, the lungs are more vulnerable to infections than a healthy person's lungs. So for someone with COPD, a respiratory infection isn't just a minor illness, it's the #1 trigger for an exacerbation or a flare-up of symptoms. So viruses account for about 30% of exacerbations of COPD or flare-ups. And these flare-ups are not only the primary reason for emergency room visit and hospitalizations, but with each flare-up, it's associated with an accelerated decline in lung function. So while we can't cure COPD, we can be proactive about preventing the events that can make it worse. And because it's difficult to just live in a bubble, vaccination is the best defense with the goal of reducing hospitalizations, slowing lung function decline, and ultimately living longer and healthier lives. So we'll get into the first vaccine, which is the influenza vaccination. This one I'm sure you've heard of before. So it causes the flu. It typically lasts about 7 to 10 days, and the most severe symptoms usually peak around the 3rd to 7th day, and then begin to decrease. But you can get a lingering cough, as well as tiredness, and that can last for up to 2 weeks or sometimes longer. Symptoms of the flu might include fever, cough, a headache, muscle pain, tiredness, sore throat, runny nose, or chills. You can also get gastrointestinal symptoms such as nausea, vomiting, and diarrhea, although this is more common in children as well as sometimes older adults. Complications of the flu. So it itself can cause a pneumonia. So that would be a primary viral pneumonia. But as your body's fighting off the virus, you're also more susceptible to bacteria. So you can get a secondary bacterial infection of the lung. You can also get exacerbation of underlying disease, such as COPD. And then there's other less common, although significant things that the flu can cause, such as inflammation of the heart called myocarditis, muscle breakdown called rhabdomyolysis. You can get inflammation in the brain termed encephalitis, as well as something called Guillain-Barré syndrome, which is inflammation and rapid onset muscle weakness. But this is very rare and can be caused by the flu. So how does the flu spread and when should we be cautious? So the influenza virus is highly contagious. It spreads very easily. It's primarily spread through respiratory droplets. So when you cough, sneeze, or talk, these respiratory droplets can go into the environment. But you can also get it from touching a surface that's contaminated and then touching your mouth, nose, or eyes. So a person can be contagious even before they feel sick. They're most contagious during the third and fourth days of illness, but you can be contagious for up to a week. The flu season, as you know, in Canada, it typically runs from the late fall through the early spring, so it peaks in the winter months. So we do recommend for everyone, as well as the patients with COPD, the flu vaccine annually every fall. So for a person with healthy lungs, a case of the flu might mean a week in bed, but for someone with COPD, it can mean a stay in the hospital and even potentially in the ICU. There's very robust evidence that it's highly effective at preventing exacerbations and hospitalizations in patients with COPD. And this ranges from 70 to 84% for preventing exacerbations or lung flare-ups, and up to 88% for reducing hospitalizations. And this is in real-world studies. So the influenza vaccine itself, it provides protection against the influenza infection and illness. This immunity is achieved about 2 weeks after you're vaccinated, but there might be some protection afforded in the time before that as well. The effectiveness of the vaccine can vary from season to season, and this is dependent on what flu virus is present and what vaccine strain or type is in the vaccine itself. So they try to match it based on what predicted strain they think is going to come next. And even if there is a less than ideal match, vaccine recipients, especially the people at high risk of influenza-related complications, are still more likely to be protected compared to those who are unvaccinated. And then lastly, vaccination before the onset of influenza season is strongly preferred. Just so you don't lose an opportunity to be protected during peak times. But getting the influenza vaccine at any time of the season is still very helpful. So the available vaccines, it's the one recommended with COPD, as well as the one that's most common, is an inactivated virus vaccine. So that means it contains a killed flu virus, so it cannot give you the flu. It's administered as an intramuscular injection, so a needle, usually into the arm. And in Canada, the flu shot is publicly funded, which means it's free for everyone. So I know I've told you about complications of the flu. What about effects from the vaccine, the flu vaccine itself? So the most common side effects would be injection site reactions. So where you get the needle, sometimes you can get some pain, redness, and swelling, and that usually resolves within a few days. You can also get more systemic or full-bodied symptoms such as tiredness, headache, muscle aches, and fever, but this is generally mild, transient, and only lasts for a few days. The very, very rare but very serious events would include an anaphylactic reaction, but this is typically due to an allergy to a component in the vaccine. And then also very rare would be something called Guillain-Barré syndrome or GBS, I previously mentioned. And with the seasonal flu vaccine, it's about 1 extra case per million vaccinations, and that's significantly lower than the risk of GBS from influenza itself. So our next vaccine we'll chat about is the pneumococcal vaccination. So what is pneumococcal? So Streptococcus pneumoniae is a bacteria and it can cause infection. It is the most common cause of lung infection or pneumonia, hence its name. So it can cause various infections, lung infection, ear infection, sinus, and other areas of the body. Severe infections, termed invasive pneumococcal disease, is when it invades a site that is normally sterile, so where the bacteria shouldn't be at all, such as in the blood or brain. And there are a few conditions that are at increased risk of invasive pneumococcal disease or a severe pneumococcal infection, and COPD is one of those conditions. So how does it spread? Unlike viruses, which can often be airborne, the pneumococcal bacteria is spread through direct contact with respiratory secretions. So that can be saliva or mucus. The real danger is that a person can be a carrier without ever feeling sick. So they have the virus, but it's not affecting them. It's a term called colonization. So you can't always tell if you're at risk. Like the flu, these infections tend to spike in the winter, but they can be present all year round. You can be contagious as long as you have the bacteria present. If you're infected and treated with antibiotics, you're usually non-infectious in about a day or two. So how can we protect against pneumococcal disease? So we do recommend that all patients with COPD be vaccinated against this infection. So the general recommendations is everyone 65 and older, as well as those 19 to 64 with COPD. The pneumococcal vaccination is associated with a decreased risk of community-acquired pneumonia and exacerbations in COPD. It reduces it by nearly half. So if 8 people with COPD were vaccinated, 1 exacerbation of COPD would be avoided. So this is a bit of a busy slide, but bear with me. So the National Advisory Committee on Immunizations, or NACI, it makes recommendations in Canada for public health, and then it provides its recommendations to the provinces and territories, and they make their own decisions regarding which vaccinations and funding. So they recently recommended the Pneumo C20 or the Prevnar 20 vaccination. So the recommendation is for those who previously have not been vaccinated or you don't know your vaccination status. Everyone 65 years of age and older should get it, as well as those 50 to 64 years with COPD. If you're 65 and older and you've previously been vaccinated with one of the vaccines listed below, they also recommended you get a Prevnar 20, but 5 years from your last dose. There are some alternative schedules that you can use as well if Prevnar 20 isn't available, and you can talk to your pharmacist more about that. So the pneumococcal vaccine, the ones available in Canada are the Prevnar 20, the Capvaxive, the Prevnar 13, the Vaxneuvance, the Pneumovax 23. The good news is that for people with COPD, these vaccines are mostly publicly funded and free of charge. In BC, those 65 and older with COPD, it is free. If you're under 65 with COPD, it's likely covered, but you should check with your pharmacy and insurance, and you might require a prescription as well. Out of pocket, I believe it's about $130. So in BC, as of this past July, they introduced a Prevnar 20, and this replaces the previous Prevnar 13 and Pneumovax 23 that they had. And this protects against infection from 20 different strains of pneumococcal bacteria. So it does provide very good protection, especially compared to the previous vaccines. So moving on to the COVID vaccination, which has been in the media a lot over the last few years. So we've learned a lot about how COVID-19 spreads. It's not just a droplet spread, it's also airborne, and that's why staying home when sick and improving indoor ventilation are so important. So it primarily spreads through aerosols and droplets. So again, coughing, sneezing, breathing, but it can also stay in the air as well. And then again, it can be spread if you're touching contaminated surfaces, but this is less common. A person can be is most contagious from 1 to 2 days before symptoms to about 8 to 10 days after symptom onset, with symptoms typically developing about 5 days after the exposure. So regarding the seasonality of COVID-19, it can be transmitted year-round, but in Canada, we do see a lot of surges both in the fall and the winter times. So we do recommend that an annual COVID vaccine for all adults with COPD. You may be eligible for a second dose at a 6-month interval. If you're 65 and older, you're a resident of a long-term care, or you're immunocompromised. So people with COPD are at a higher risk for severe COVID-19 outcomes compared to the general population, and this is why it's crucial that we recommend it to our patients with COPD. If you've previously been vaccinated or you've tested positive for COVID, you do need to wait a minimum of 3 months from the time that you've been test confirmed positive for COVID. And then you can go back to your regular schedule. So with the COVID vaccine, it has been shown to reduce the risk of severe infections, reduce hospitalizations, as well as reduce death. So clinical trials and real-world data have shown that 2 doses of the COVID-19 vaccine can provide nearly 100% effectiveness against hospitalization and death. And as immunity can wane, the booster doses further strengthen that protection. Studies have also shown that getting vaccinated has an impact on healthcare utilization as well. So this reduces the number of emergency visits and hospitalizations in our COPD population. So the types of vaccines that we have, the most common right now, especially in BC, I think is Pfizer and Moderna. So they have the highest effectiveness against symptoms and severe COVID disease, provides greater than 90% effectiveness against severe outcomes. They also have a very great safety profile. The other 2 vaccines do provide good protection as well, but although not quite as strong as the Moderna and Pfizer vaccinations. So what are the adverse events of vaccination? So you'll probably start to see a trend here, but the most common would be local injection site reactions. So again, you may get some pain or redness or swelling at the injection site. These typically occur within 1 to 2 days after vaccination and resolve within 2 to 4 days. You can also get, again, some systemic or full-bodied symptoms. So tiredness, headache, muscle pain, fever, and chills. Rare events are not increased in adults with COPD, so same with the general population. And those would include things like heart inflammation, myocarditis, blood clot, and again, Guillain-Barré syndrome. But the events are higher with the disease itself than with the vaccination. So it's still highly recommended, and they're very, very rare. So again, we already talked about the available vaccines. In Canada, they're publicly funded for all eligible Canadians, and they're free of charge. So next, we'll move on to the pertussis vaccination. So pertussis is commonly known as whooping cough. It's a highly contagious respiratory infection. It's a bacterial infection caused by the bacterium Bordetella pertussis. And infections can lead to uncontrollable coughing, it's usually a bit of a whooping sound, and that's kind of where it gets its name from. It can also be associated with coughing so hard that you vomit. And this is usually after severe coughing episodes. Serious complications can include pneumonia or lung infection, seizures, and then also hernias giving the forceful coughing. So again, pertussis is extremely contagious. It's usually spread by coughing or sneezing when you're in close contact with others. But it can also be from sharing personal items, so drinks or utensils. It's most contagious during the first 1 to 2 weeks of illness. And this is even before the characteristic whooping cough begins. And you're contagious up to 3 weeks after the cough starts if you're not treated with antibiotics. And pertussis can occur year-round, and there can also be outbreaks of it as well. So we do recommend in the COPD population a one-time booster dose as an adult. Most people do get a series as an infant and in childhood. It's also recommended to get in every pregnancy as well. In our COPD population, it's crucial as the violent, uncontrollable coughing fits. They can be catastrophic, triggering a severe exacerbation, and it's difficult to recover from. So a single booster dose of the Tdap vaccine, it also protects against tetanus, diphtheria as well, and can provide lifelong protection. And patients with COPD are at increased risk for pertussis infection. So the available vaccines is called the Tdap, so it includes tetanus, diphtheria, and pertussis. The Tdap vaccine is publicly funded and free for eligible adults in most provinces, but in BC, most will have to pay out of pocket. There are some exceptions, such as pregnancy, adults who have not been fully immunized, or those whose immunization history is unknown. And I believe it's about $60. So next, we'll move on to the RSV vaccination. I know this was touched on a bit last year, but we'll review it again quickly as well. So this virus is common and contagious, and it affects the lungs and respiratory airways. It usually affects the young, the old, and those at risk, whether they have an underlying disease or they're immunocompromised. The common symptoms would be fever, cough, a runny nose, headache, tiredness, and wheezing. Symptoms can range from mild to severe, and they can last up to 2 weeks. So it spreads very similar to the flu. It's transmitted via droplets. So hand hygiene and avoiding touching your face, again, are important. Like the flu, it's also a seasonal virus, so we recommend getting vaccinated before the fall for optimization of coverage. It's typically contagious for about 3 to 8 days, and you can even be contagious a few days before your symptoms begin. Adults with a weak immune system, they can be contagious for as long as 4 weeks. So who's at risk? RSV can happen at any age. It's usually mild, but can cause serious infection in some people, especially adults over 60 years. Older adults are at a higher risk for severe infection, as their bodies may not be able to effectively fight off the viruses, as well as someone with a younger immune system. RSV infections can increase the risk of hospitalization for people with diabetes, lung diseases such as COPD or asthma, heart disease, liver or kidney disease, as well as those with weakened immune systems. And RSV can cause serious complications such as pneumonia, as well as worsening of your underlying conditions, such as COPD, causing a flare-up. And rates of hospitalization and death due to RSV are comparable to that of the flu, so it's quite common. So we recommend that adults aged 75 years and older, as well as those 60 to 74 with COPD, we recommend the RSV vaccination. Adults with COPD are at increased risk for severe RSV disease, and this includes being hospitalized, ICU admission, and even death. The evidence for the RSV vaccination is strongly supported for adults with COPD, as it's efficacious in preventing severe RSV disease and hospitalizations. And as we know, RSV is associated with approximately 10% of COPD exacerbations. So regarding the vaccinations available in Canada, we currently have 2 approved and available, Arexvy and Abrysvo. I believe Arexvy was the first to market. They've both been shown in large clinical trials to be highly effective at preventing severe illness and hospitalization. The good news is that the efficacy and safety profiles of these 2 vaccines are comparable, so a choice between them can be based on availability or personal preference. They reduce the RSV-associated lower respiratory tract disease and severe outcomes by 75 to 82% in adults 60 and older, and that includes those with COPD. And then the effectiveness against hospitalization ranges from 58 to 80% in this population. There's also another vaccination called Moderna that is available in the States, but it hasn't yet been approved in Canada for adults. So with this vaccination, you develop immunity in about 2 weeks after you get the RSV vaccine. And the immunity appears to last for at least 1 RSV season and up to 2 seasons. So what are some possible side effects? So the very common side effects, again, would be local injection site reactions, about 23 to 29%. That would be pain at the injection site, redness, mild systemic symptoms, about 7 to 11%, which can be headache, tiredness, muscle pain, and joint pain. And then uncommon side effects would be allergic reactions, such as a rash, feeling sick, maybe some stomach pain. Serious adverse events are reported less than 1% of the time. And then post-marketing, we haven't noticed any new signals. Rare events such as GBS that we've talked about before, it's been reported, but the incidence is low and casualty. So establishing that it was caused by the virus, there's still ongoing research and we haven't established that yet. So cost, this is the barrier for many of my patients that I see. So depending on what province you live in, and if you have any extended health benefits, whether it's covered. So in some provinces, it is publicly funded and free for high-risk groups. So such as Ontario, for those living in long-term care homes, and some retirement homes. In other provinces, and this includes BC, it's not publicly funded. It can cost over $200 out of pocket. So if finances are a concern for you, I suggest shopping around and seeing kind of what the best prices that you can get. And you may need to check with your private insurance to see if it's covered. Also, some provinces you might require a prescription, such as Nova Scotia. So regarding this vaccine, I recommend discussing with your local healthcare provider or pharmacist so you can understand your specific situation regarding the cost. Okay, so now we'll kind of focus in on how this can be more related to you. So can the vaccines be taken together? Yes. The National Advisory Committee on Immunizations states it's safe and effective to co-administer most vaccines. So the benefit of co-administration, so it will reduce the number of appointments you need and it ensures you're protected quickly, especially for the vaccinations around the fall and winter seasons. For example, the pneumococcal and influenza vaccines can also be co-administered. So I recommend checking with your provider and then you can discuss with your doctor or pharmacist what the best schedule for you is. As an example, the RSV vaccine should be given at least 6 weeks before or after the non-seasonal vaccines, which could be shingles or diphtheria, tetanus vaccines. Okay, so now we'll talk about other preventative measures. So what can you do besides getting vaccinated? So first, you've probably heard of hand hygiene. So it's the most effective non-pharmacological method to prevent the spread of respiratory infections, and this includes pertussis, RSV, and frequent and thorough hand washing with soap and water, as well as the use of alcohol-based hand sanitizers, significantly reduces transmission risk. Next is cough or respiratory etiquette. So covering the mouth and nose with a tissue or elbow when you cough or sneeze, as well as avoiding close contact with those individuals who are symptomatic is recommended to reduce droplet spread. Next up is masking. So whether you use a surgical or procedural mask, this reduces both source admission, so from the person who's doing the coughing, as well as exposure, so the person who the droplets are going towards, especially in crowded or poorly ventilated settings, as well as during periods of high community transmission. So whether you're in a plane, a packed public area, we do recommend wearing a mask if you're at high risk. Next up is the indoor environment. So environmental cleaning, often of high-touch surfaces and shared objects. And this includes for pertussis and RSV, which can survive on surfaces for hours. You can also improve your indoor air quality with improved ventilation. Otherwise, you can consider an air purifier with HEPA or HEPA filter. And this can reduce the concentration of airborne viruses. But current clinical evidence does not demonstrate a consistent reduction in the incidence of respiratory infection, although it has been shown to reduce the concentration of the airborne viruses. And then lastly, avoid contact. So often harder than it sounds, but try to avoid those who are sick. So again, avoiding crowded or poorly ventilated spaces, especially during peak respiratory virus seasons, limiting exposure to sick contacts, and those who are at high risk, and always be sure to return the favor. So if you can, try to stay home when you are sick and avoid the spread to others. All right, so we'll just do a quick review here. So to summarize, vaccinations are a cornerstone of COPD management. The evidence is robust. These vaccinations save lives and prevent hospitalizations and other unfavorable outcomes. We discussed 5 vaccinations today, including influenza, pneumococcal, COVID, pertussis, and RSV. For each, we discussed the facts about transmissions, when they're present, and who's contagious. We discussed the recommendations for each, and I'll do a little reminder on the next slide, as well as talked about the cost, if any. We talked about the ability to combine or co-administer vaccinations to save time and get earlier protection. But despite robust evidence for the efficacy, vaccination rates in COPD populations remain suboptimal, which underscores the need for us to improve implementation and patient education. So hopefully with this presentation, you've learned a little bit about vaccinations and how they can be helpful to you, so you can take control of your health and be proactive. So the recommended vaccinations in those with COPD would be influenza annually every fall, the pneumococcal, the COVID vaccination annually, and consider a 6-month interval. Pertussis, 1 booster as an adult. RSV, 60-74 with COPD and older. And then a vaccination that I didn't touch on, but is also recommended, would be the Shingrix vaccine, and that's recommended for everyone with COPD greater than 50 years old. Some additional resources would be the Canadian Thoracic Society. That's based obviously out of Canada. It has guidelines that us physicians aim to follow. Another great resource would be the Chronic Obstructive Lung Disease, or GOLD guidelines. It is based out of the US, but it has some very good data and patient information. A lot of my information was from Immunize Canada. There's also information on the Government of Canada website regarding vaccines and immunization. We talked a lot about the National Advisory Committee on Immunization. For BC specific, there's the HealthLink BC, as well as BC Centre for Disease Control. Speaking worldwide, the World Health Organization, or WHO, is another good resource. And then lastly, if you want to do a deep dive or a literature review, I would also recommend the Cochrane Library. So here are my references. I'll gloss over those. So thank you. So now would be the time if you have any questions. I hope you learned something, and thank you so much for having me.
Thanks, Caitlin. Do you want to, well, actually, let's leave your PowerPoint up in case you need to click back to some slides. There are a couple questions in the chat. We can go through those first, and then we'll open up the floor to any other questions. Bev had the first question. She asked, with the COVID vaccine, what does the delayed skin reaction listed in the rare events? Bev, do you want to unmute and elaborate on your question a wee bit more?
There. I was just wondering, like, what exactly does a skin reaction, what does that mean? Like, is it just redness or
Yeah, no, great question.
flaky skin or peeling skin?
It could mean a number of things, but I think for, like, generally speaking, it would be swelling, redness. It could be sore or itchy, less often flaky, and very rarely blistering. It's not known to do that, but I would imagine it'd be kind of raised skin, red, possibly painful and itchy would be the main finding.
Okay, thank you.
Thanks, Bev. Adam had a question about the tetanus shot. He received one in December of 2023. Does that tetanus shot cover pertussis? The drug was TD absorbed, he listed.
So the TD vaccine does not cover pertussis, which is unfortunate because that vaccine is, the TD vaccine is covered, and you should get it updated every 10 years, I believe, for tetanus, but it does not contain the vaccine against pertussis. It has to be the Tdap, so the AP in it would be pertussis.
Okay.
Great question.
Hopefully that answered your question, Adam, or addressed it a little further. Erica followed up. She asked, should you have Prevnar 20 no matter what, if you have already had the Prevnar 13 within the last 4 years, or are you still okay with just the Prevnar 13?
I would double check with your pharmacist, but you should get the Prevnar 20 about 5 years after your last vaccination. So I would recommend getting it again in a year. It does cover some more serotypes, as well as boosting immunity for the serotypes you've already received. So I would get it 5 years after your last vaccination of the pneumococcal.
Okay, so in about a year, Erica, the Prevnar 20 will give you a broader range of protection. Good. Amber just said, I received, I believe it says Prevnar 13 2 years ago, but she got pneumonia again in June. Should they consider the Prevnar 20, or still continue to wait for that 5-year window?
Sorry, which one did she receive?
The Prevnar 13, I think.
Yes, I received the Prevnar 13.
Thanks, Amber. Yeah.
Did you complete the course of the 2, or have you only had the 13 before?
I did the 13. I presume the booster as well. But in June I got pneumonia again. So I'm just wondering if maybe the Prevnar 20 would be something to look into, if Prevnar 13 only covers certain strains, or
Yeah, so I'd recommend getting Prevnar 20, probably the 5 years after your last vaccination. And just
Okay.
because you had pneumonia before, we still recommend getting the pneumococcal vaccination, as it can prevent, well, we're not sure maybe you are sure what pneumonia you had, but it can prevent further episodes, and it might have been different than what you had as well.
Okay, thank you.
You're welcome.
Question.
Oh, yeah. No, Alexa's on. Good.
Yeah. So just wanted to say Emily had to jump off, but she wanted to say thank you for the talk. She really enjoyed it. Adam had a question. I had Prevnar 20 in January 2024. I'm over 75. Should I have the Prevnar 23?
Let me pull up that slide here. I would double check with your pharmacist, but I think if you've had the Prevnar 20, I don't think you need repeat vaccinations at this point. Especially if it's been over 5 years, maybe double check with your pharmacist. But the current guidelines, I think it would just be the Prevnar 20 at this point.
Perfect. And Naomi had a question about the RSV vaccination. Should we be getting an RSV shot every couple of years, or is it a one-time only?
That's a great question. So right now it's only recommended once, but giving kind of the waxing immunity of it over a year or two, there is ongoing studies and data, and depending on funding and whatnot, in the future, I imagine it might become one of those vaccines that we do get annually or every few years. But as of current, it's only a one-time dose.
Hopefully that helps, Naomi. That's it for questions in the chat. Does anyone have any questions that have popped up? And if you do, just unmute yourself, say your name, and then you can state your question to Caitlin or Katie.
My name is Ted. I'm
Perfect.
wondering if there's a way of finding out if you've had the TD or the Tdap vaccine.
Yeah, great question. So I think anyone feel free to speak up if you know, but I think on HealthLink, you can check your previous vaccination status. If you have difficulty doing that or can't find it, then I would reach out to your pharmacist or physician, as well as health records, to see if you can track down your previous vaccinations.
Okay, thank you.
Ted, I think I can add on to it because I had to go through this. I think if you've had it through the public health office and they administered it to you, you could call them and see if they have any record for you as well.
Okay.
The only complication that would happen is if you got vaccinated in different provinces. So if all your vaccines were in BC, then public health should be able to pull that up. But sometimes ones that, say if you lived in Alberta and then you moved to BC, there may be a gap there.
Yeah, they don't transfer the data.
Okay, does anybody know a number for public health or?
I can look it up for you, Ted.
Okay, thank you.
Yep, I'll put it in the chat box if that works for you.
You bet, yeah.
Okay.
I have a question. It's Bev.
Yeah.
If you have a different, a doctor and pharmacy, how can you check which vaccines you've had, like when you had the last pneumonia one?
Good
My,
question.
like,
Yeah. I did you get your vaccine administered at the pharmacy?
the pneumonia one, no, was at the doctor's office.
Okay, so the doctor should have the record of that if they provided it.
He's retired.
Okay. Maybe public health or
Public health.
HealthLink would be places to start. Lindsay, I don't know if you have anything else to add.
I might suggest that when your physician retired, were you taken over by another physician in town?
No, I had
Okay.
switched. Yeah.
Okay, and so do you know what happened to your patient chart?
No idea.
Okay, is your physician, were they working out of a clinic with other physicians there?
No.
Oh, you're answering not all my suggestions. It's all right. I was gonna say, yeah, maybe call public health as well for within the city that you're in and see what they suggest if they know what happened to those records. They have to end up somewhere. I don't think they just go poof in the air. So call them and see if they have any recommendations about where your patient chart went. Yeah.
Correct, Lindsay, they can't get rid of them legally, so they are somewhere, and I think public health is the best way, and they will know where to direct you and probably give you a number if they're unable to give you that information.
Good.
Perfect. Okay, thank you.
Yeah. We get there with 3 of us. We can get an answer.
Yeah.
Any other questions from any of our attendees?
When is the flu vaccine available in BC? Do we know?
Ooh.
Ooh.
I feel like it's October when it starts being released.
Yeah, I want to say we should probably get word soon when you start going into the pharmacies. They'll start having it advertised, but usually October is when they start putting the advertisement out for it.
Yeah.
They're just being
Okay.
manufactured right now.
Okay.
In Alberta, you actually have to pre-register to get your COVID and influenza vaccine. So they don't just have them available. You have to
Wow.
request them to get them later.
Does anybody know if the hand sanitizer expires? Like if you've had a bottle of it for a year, or should you junk it and get a new one, or is it still effective?
Yes, and it can be degraded by heat or sunlight.
Yes.
There should
Okay.
say an expiry date on your hand sanitizer.
Okay,
It's
thank
usually
you.
a couple year, but as long as you're not having it around heat or a way that it can break down.
Like I leave some in my car, and if it's in direct sunlight, I replace it every few months because it
Yeah.
kind of breaks down.
Okay.
Yeah. And Ted, did you get that phone number out of the chat?
No, I haven't actually.
Oh yeah, click on that before it goes away when we end the meeting.
Chat. Okay.
I can read it out to you if it helps.
Sure, read it out. Yeah.
250
Okay.
851
Okay.
7300.
Super. Got it.
Perfect.
Thank you.
All right. Last call for questions from our expert before she has to go and do her work.
Okay, I have a question for Doctor.
Yeah.
My name's Warner, and you mentioned that the RSV shouldn't be taken within 6 weeks of any other non-seasonal injection. Now, I take a Nucala injection every 4 weeks. So it's pretty tough to get a 6 week period in there.
Yeah. So you should be able to still take it. So I would probably take it maybe somewhere in the middle. The main reason they do recommend that is because the RSV vaccine, we have great data on it. But if you do get a reaction, the drug company wants to know that it was from that vaccine and that vaccine only and can't be attributed to anything else. So I would just double check with your pharmacy regarding optimal timing, but I think that the reason was more for so they know what the cause was if there were a reaction.
Thank you.
You're welcome.
That was actually a really good question. We've had that one a few times in the past about waiting a certain window and if you're taking other vaccines for other conditions. So that's good to know for sure. All right, then. I'm going to say thank you to everyone for attending. We really do appreciate everybody coming and spending their time with us. Next month, October 15th at 2 p.m., we will be having Kira McFarland, a nutritionist from Kamloops, speaking about nutrition and COPD, which is always important to eat healthy for your health condition and status. So registration should be up in the next week or so for that. So please keep an eye out. And Caitlin, thank you so much for your time. This was a wonderful talk. I think we're gonna have to have you back.
Thank you so much, everyone. Happy to be here. Hopefully you learned something.
Thank you so much, everybody.